Do you feel down during certain times of the year? This isn't just about missing the summer sun or dreading the winter chill. There's a specific term for this periodic shift in mood: seasonal affective disorder, or SAD. It's more than just the winter blues. SAD is a type of depression that's not always winter-bound. It's a mood disorder that can strike at any time, but is particularly prevalent during certain seasons of the year. Imagine a cloud that appears only during specific seasons, casting a shadow over your usual sunny disposition. That's SAD. It's a real, diagnosable medical condition, not just a phase or a bout of the blues. It's like a seasonal storm in your brain, which can make life seem a bit grayer than usual. So if you've noticed a pattern, a recurring gloom that seems tied to the changing seasons, it's not just you. If you've been feeling this way, it's possible that you might be dealing with seasonal affective disorder. So what causes seasonal affective disorder? Now that's a question that's been puzzling scientists for a while. Let's delve into the main culprits believed to be behind this condition. One of the primary suspects is the lack of sunlight. You see, during the colder months, the days get shorter and sunlight becomes a rare commodity. This lack of light can mess with your body's internal clock, also known as your circadian rhythm. This rhythm is responsible for telling your body when it's time to wake up or go to sleep. So when it's dark outside by 5 in the evening, your body may start producing sleep hormones, making you feel lethargic and down. But it's not just about the sunlight. Changes in the levels of certain chemicals in your body can also play a significant role. One of these chemicals is serotonin, a neurotransmitter that affects your mood. Some studies suggest that reduced sunlight can lead to a drop in serotonin levels, triggering depression. Then there's melatonin, a hormone that regulates sleep and mood. The production of melatonin increases when it's dark, so longer nights could mean more melatonin in your system. This overproduction can result in feeling sleepy and low. Let's not forget about the role of genetics in your personal history. If you have a family history of depression or SAD, you might be more susceptible to developing the condition. And if you've experienced depression or a mood disorder before, the risk of SAD increases. Lastly, where you live can influence your chances of getting SAD. Living far from the equator, where winter daylight hours are very short, can increase the likelihood of this disorder. So to wrap it up, a lack of sunlight, changes in your body's internal clock, and shifts in levels of serotonin and melatonin in your body, along with your genetic makeup and geographical location, can all contribute to the onset of seasonal affective disorder. These factors can combine to make you feel depressed during certain times of the year. So, let's continue to shine a light on SAD and explore its symptoms in our next segment. What are the signs that you might be dealing with seasonal affective disorder? Seasonal affective disorder, or SAD, manifests itself through a variety of symptoms. These symptoms can vary from person to person, but there are a few common ones that are worth noting. First and foremost, the most common symptom of SAD is a feeling of depression that persists for most of the day. This isn't just feeling a little down or blue, it's a pervasive feeling of sadness or hopelessness that lingers and doesn't go away even when good things happen. Another common symptom of SAD is a loss of interest in activities you once enjoyed. For example, if you used to love going for a run in the morning but now find it difficult to muster the energy or motivation, this could be a sign of SAD. This lack of motivation and interest can extend to social activities as well, leading to withdrawal from friends and family. Speaking of energy, a significant drop in it is another common symptom of SAD. You may find yourself feeling sluggish, tired, or having difficulty concentrating. Tasks that were easy before may suddenly seem overwhelming. Additionally, SAD can cause disruptions to your sleep. You may have trouble falling asleep or staying asleep, or you may find that you're sleeping too much. It's not uncommon for people with SAD to experience a shift in their sleeping patterns, particularly a tendency to oversleep. Changes in appetite or weight are other potential signs of SAD. Some people may experience a craving for foods high in carbohydrates, leading to weight gain. Others may lose their appetite altogether and see a drop in their weight. Finally, feelings of worthlessness, guilt, agitation, or having thoughts of death or suicide are serious symptoms that require immediate attention. If you or someone you know is experiencing these symptoms, it's essential to seek help right away. These symptoms can be distressing, but there is help available. Remember, there is no shame in seeking help. Mental health is just as important as physical health, and there are resources available to assist you in managing and overcoming seasonal affective disorder. There are effective treatments for seasonal affective disorder. As we delve into this segment, we'll explore 3 primary treatments for SAD: light therapy, medications, and cognitive behavioral therapy. We'll also underscore the significance of self-care practices such as getting ample sleep, maintaining a healthy diet, and staying active. Light therapy, also known as phototherapy, is one of the most common and effective treatments for seasonal affective disorder. This treatment mimics natural outdoor light and is believed to cause a chemical change in the brain that lifts your mood and eases other symptoms of SAD. Light therapy requires sitting a few feet from a special light box so that you're exposed to bright light within the first hour of waking up each day, typically for about 20 to 30 minutes. Though some people may notice improvements in their mood after just one light therapy session, most people with SAD need to continue light therapy throughout the winter months to keep symptoms at bay. Next on our list is medication. Certain types of antidepressants can be effective in treating SAD. Selective serotonin reuptake inhibitors, or SSRIs, are commonly used. As with any medication, SSRIs can have side effects, so it's important to talk to your doctor about what to expect and to weigh the pros and cons of this treatment option. Keep in mind that it often takes several weeks to feel the full effects of these medications, so patience is key. Another effective treatment is cognitive behavioral therapy, or CBT. Instead of trying to eliminate winter depression, CBT for SAD uses cognitive restructuring to help you change your negative thoughts and behaviors that might be making you feel worse, and behavioral activation to help you cope with the winter months. CBT can be a helpful tool in managing your symptoms and improving your quality of life during the winter months. In addition to these treatments, self-care practices play a crucial role in managing SAD. Maintaining a regular sleep schedule can help ensure you get enough rest. Eating a healthy diet can provide the nutrients your body needs to combat the symptoms of SAD. Regular physical activity, especially outdoors, can help increase your energy levels and mood. While each of these treatments can be effective, it's important to remember that what works best may vary from person to person. It's crucial to consult with a healthcare provider to find the treatment plan that's best for you. In conclusion, while seasonal affective disorder can be a challenging condition to live with, there are effective treatments available. Whether it's light therapy, medication, cognitive behavioral therapy, or self-care practices, there are options to help manage and lessen the impact of SAD. And remember, it's perfectly okay to seek help. You're not alone in this fight. With the right treatment, you can manage your SAD symptoms and feel better. Let's shine a light on SAD and conquer it together. Seasonal affective disorder is a real and serious condition. It's crucial to understand this, to grasp its implications, and to realize that it's far more than just winter blues. We've journeyed together, learning about this condition that affects so many people as the seasons change, its causes, symptoms, and treatments. Let's revisit the key points. Seasonal affective disorder, or SAD, is a type of depression that occurs at certain times of the year, usually during the fall and winter months when daylight hours are shorter. The exact causes are still unknown, but it's believed that the lack of sunlight may disrupt your body's internal clock, leading to feelings of depression. The reduced sunlight can also cause a drop in serotonin, a brain chemical that affects mood, and melatonin, a hormone that regulates sleep and mood. The symptoms of SAD can be quite debilitating, ranging from persistent low mood, lack of interest in everyday activities, irritability, feelings of despair, guilt, and worthlessness, to physical symptoms like lethargy, sleeping for longer than usual, and craving carbohydrates leading to weight gain. But here's the good news. There are treatments available for SAD. Light therapy, psychotherapy, and medication are all viable options that have been proven effective. Light therapy in particular has been a beacon of hope, mimicking outdoor light and causing a change in brain chemicals linked to mood. It's essential to remember that help is available. There's no need to suffer in silence or try to tough it out. If you or someone you know is experiencing symptoms of SAD, reach out for help. Consult with a healthcare provider, a trusted medical professional who can guide you towards the right treatment. In the end, the most important thing is to shine a light on your mood, to understand it, to acknowledge it, and then to take steps to conquer seasonal affective disorder. Remember, it's important to shine a light on your mood and take steps to conquer seasonal affective disorder.